it's Dr. Michelle again at Valley Vet. We're starting week 2 of Toxin month, and today I thought I'd talk with you guys about rat bait. Rat bait is something we fairly frequently see, probably at least once a month. It seems to come in threes, and sometimes it comes in with 3 dogs at once. With rat bait in general, we have a couple different types on the market, which makes it pretty scary because depending on which type your pet gets into, we can have some pretty severe consequences, and some of these have no basically antidote for them. So I thought today I would go over the 3 most common types that I see, what the clinical signs are associated with those, what we kind of do for overall treatment, and then we'll talk about prevention of rats anyways without using toxins, because frankly none of the rat baits out over the counter are safe for pets. Even if they come in cool contraptions that you think are safe, our dogs are really clever, and they're gonna figure it out. So the first one, the most common one that people know of, is our warfarin or anticoagulant based rat baits. These are ones that we won't go too much into the physiology of it, but basically it's anticoagulant that's used, and so what happens is rats or your dog eats these kibbles or chunks, and it is a vitamin K antagonist, and so it goes in and actually stops your clotting from working. And so what we'll see is pets will act completely normal, and then 1 to 3 days afterwards will start showing signs of bleeding disorders. They'll start having little bleeds out of their ear, they'll bleed on their gums and their teeth, and by the time you see this, it's actually too late. And so with those, we really have to catch them at the moment it happens. So the scary thing about this is if you have rat bait out and your pet gets into it and you don't know, and you don't find out till a few days later, there's not a whole lot that we can do to prevent further damage to your animal. And so if you do catch it early, we know you bring the bag in with you, we see that it's an anticoagulant. What we can do is start them on vitamin K supplements, and they do great, and we don't have any issues. So that one's our, I guess, preferred toxin at this point. But unfortunately, they've come out with several new toxins on the market that I don't know if maybe the anticoagulants aren't working for rats or what, but the new ones that they've come out with are actually a lot more dangerous. And so the next one that we see that's fairly common is one that causes a neurologic side effect. And what this will do is start showing varying degrees of neurology type diseases. So we'll see seizures, coma, shaking, anxious behaviors, head pressing, running into walls. And that one is very scary because the signs can show up fairly abruptly after the treat is eaten, and it is absorbed very quickly from the GI tract. So if we don't induce vomiting within 15 minutes to a half hour at the most, we still have a lot of that toxin that's already being absorbed, and we do not have an antidote for this. And so for this, what we do is just fluid therapy, trying to flush out the toxins as much as possible. We'll give activated charcoal after making them vomit, but this one's very scary because if they eat a large amount of this, there's not a whole lot that we can do about it. And then the third one that I don't see as common, but I did actually have it this month, is a cholecalciferol type 1, and that actually causes kidney disease. And so that one is another one that's scary because initially they eat that and we don't notice any side effects, and then the following days we get an increase in the calcium in the bloodstream, and then that results in kidney failure, and that is irreversible as well. And so for this, it's very similar to the one that was involved with the neurologic toxin, is that we have to do decontamination procedures. Essentially, we got to give activated charcoal and do fluid basic diuresis to be able to prevent a lot of those toxins from building up. We'll also do some treatments to try to lower the calcium, but both of those are very scary. All of them are scary overall, especially if you don't see your animal get into those. And so what I've talked with people before, they're going, well, what can I use? You know, what is safe to use around my pet? I would say if you have animals at home, don't use rat bait, because you could easily end up in these situations, and you don't want to be there. It's a scary place to be, and there's ways that we can prevent it. I know mice are annoying. I live in the forest. I have them in my car, and it is very frustrating. I know I've opened the glove compartment and seen 2 cute little mice in there. My daughter's like, "That's their home. You gotta leave them there," and I'm like, "No, we gotta take care of them. So things that I have used or have talked to other people about using that can help, live traps. I've used live traps with a little peanut butter in there. That's how I got the mice on my car. Other things that people have said too, especially for vehicles or tractors or equipment that you're getting mice into, is that you can use dryer sheets. They don't like the smell of that, so you can place those around the different areas like your glove compartment, in the trunk, things like that, to help you clear with that. And then my favorite, our favorite here, is you can get cats. So cats are also a great way to help reduce your mouse population around your house. I have 2 at home, and they're a little lazy, but they do kind of help keep it under control. And then you have cats, which is awesome. So those are our favorite. I know it's probably not as helpful, but it's a whole heck of a lot safer for your pet. And I don't want to have you guys come in at 11 at night because 3 of your dogs got into rat bait. You know, no one wants to be in that situation. So that pretty much sums up rat bait toxicity. So the biggest key with that is, if you have it, make sure it's locked up well, and even if it is locked up well, know that your pet can get into it, and check it frequently. Make sure that you don't see your pet get in there, because if they do and you don't know it, it could be pretty disastrous consequences. And with a lot of the rat baits out there these days, it can be disastrous even if you know they got into it. So keep it safe. I'd say maybe if you're going to get one, make sure you get one of the anticoagulants, just because we know it has an antidote. And otherwise, besides that, we'll have some more toxins for you coming up here, and see you at the clinic.